So this is your video for how to insert an intermittent or a straight catheter. So first of all, you're going to want to make sure you check the EMR again and make sure that this person has an order for this. Usually the reason somebody would get an intermittent cath or a straight catheter is to release tension off of the bladder. Now this usually happens because of urinary retention. So let's say you had a procedure done, okay? And you're in the recovery area and you say you have to go to the bathroom, but you can't seem to release any of your urine. So they might bladder scan you and they figure out, gosh, you have 700 cc's of urine in you, 700 mils, 700 cc's of urine. And you need to extract that, but you're not able to do that at this time. So they might call in a nurse and they would perform an intermittent catheter for you. And they would measure that fluid and make sure that, hey, we've got all that urine out of somebody before we move them. So that there isn't any spillage, leakage, or anything like that going on. So for this procedure, I checked the EMR. I know that the reason they're getting an intermittent catheter, straight catheter, is because of urinary retention. It will always be a reason like that for an intermittent catheter. So I grab my kit, I grab a second set of gloves just like I did with a Foley kit because you want to make sure you got another pair just in case they break, bust, maybe you become contaminated and you want to have an extra pair with you. So I've got my pairs to go into the room and now I'm going to go introduce myself. Hi Josie, it's Rachel. I'm going to do your catheterization today. Can I get your name and date of birth? First I'm going to grab some hand hygiene and maybe add some privacy if I need to. And Josie tells me that this is Josie Cool, date of birth long time ago. Do you have any allergies, Josie? Yes, I do. I have an allergy to Tylenol and to povidone iodine. Okay, so is that a shellfish allergy or is that a true allergy? Sometimes you might want to know why someone's getting it and why somebody has the allergy. Is it a serious reaction to the allergy? Maybe they are able to get topical something or other. In this case, I have a kit that does not have povidone iodine, so I will not be using that for Josie. Josie, I will be doing that urinary catheter insertion right now, okay? It's called an intermittent catheter. It means I'm going to put it in and then I'm going to take it out, but I am going to try to collect some of the urine that's in your bladder. Now, did somebody come and do peri-care on you before you perform this procedure, or before I perform this procedure? And she said, yes, a CNA came in and did her peri-care. You always want to make sure that the genitalia has been cleansed before you do insertion. Okay, so I'm going to go ahead and get started, Josie. Is it okay if I pull back your covers? Can I ask you about your pain level, too? On a scale from 0 to 10, 0 being no pain, 10 being the most pain, what would you rate your pain level today? Josie says 0. And then, of course, if she did have pain, I'd want to know location, intensity, what's making it better. Maybe give her something for the pain if we're going to do a procedure. But in this case, we don't have to. So I'm going to pull the covers back and just get Josie as comfortable as I can get her for the procedure. Now, with a female genitalia, you want to make sure that you're frog-legging the legs. And I know that this is not comfortable for most people, male or female. So I'm going to leave the cover covered until I open up my kit. So now I'm going to go over and open up my kit. All right, I'm peeling back my brand new kit. I can touch anywhere on the outside of this kit. I just can't touch the inside of it, right? So I'm going to just get a little more hand hygiene again, and I'm going to start opening my kit. I open my kit starting away from me, to the side, holding it a little bit because I don't want it to come back at me, and here, and I'm going to turn it and square it off. I like to square mine off. You'll see me do that every time. Okay, there's another pair of gloves in here. I'm not so sure these are going to fit me, so I'm going to pinch them like this to get them off the field as safely as possible. And then I see my drape in here. So now I'm going to have to lay that same drape that I laid for the Foley kit down for this person. Shiny side is always down. I have to ask Josie if I can move her gown up, and then I'll get started with my process here. Okay, Josie, I'm moving your gown up. Is that okay? Yes, it is. Okay, I'm going to take my corner here. That's all I'm touching from my kit because remember it's sterile in there. All right, and I'm touching the corner to corner. I see the shiny side here, so that shiny side needs to lay down. All right, and I don't want to contaminate my space, so I am going to go around and reach this way. And look at that. That's a good angle and a little bit easier when they're frog-legged. to do it. But that's on there good. We want a pathway here that's sterile still. Okay. Then we have that fenestrated drape, which is what I've told you about on the other video too. Now you can certainly use this. It actually works a little bit better for females than it does for males. And that's just another drape that you can use. For the sake of this video, I'm not going to use it because I would like you to see the insertion as best as possible. So, I really can't touch anywhere else in my kit, but I did grab what they call chlorhexidine. It's a cleaning agent just like povidone iodine, but we need something else for this person because they have an allergy. Same would be if you were using a Foley kit and they had a latex allergy. You'd want to make sure you had a silicone or plastic Foley. So I'm going to look off. I see chlorine or chlorhexidine expires in 1 week. I break the seal on this container. I'm pouring it very gently over the top of my cotton balls, and only 1 pour is allowed. Okay, and now I'm going to have to open up my sterile gloves because I really have no access to any of this right now. As you can see in there, there's a specimen kit. Now, we don't need to grab a specimen for this, so I'm going to probably take that out as soon as I get my gloves on. How do I do my gloves again? Put your hands tuck under, get a good grip so you have good control. Don't let go. Walk your hands down. Pinch, pinch, pinch. Put the flap back. Turn your gloves a little bit. You can touch the inch around the edges of both of these fields, but try not to contaminate or cross them over. Okay, so I see my glove here. I'm going to grab my non-dominant hand, pick it up, and I'm going to put my hand into this glove. All right, now I'm going to grab those 4 fingers again, put them into my glove, hitchhike that thumb, and I've got my sterile gloves on. Lock in my hands. I can move that if I want to, move it, trash it if I want. Now I'm looking at my kit. What do I have in my kit? Well, I have a little container of lubrication. I need to actually squeeze that out and put that into the side. If I were needing to do a specimen of any kind, so let's say they want a urine sample, they're checking for ketones or they're checking this sample, I would then set this aside, except for this container here, and I would maybe just set these on here for now. And then I would use this as soon as I started getting return. I would then pour some in there and then try to move that cup back over to my table while I continue to decompress the bladder with the urine. Let me open this container. That was a little hard for me. And I'm just going to move this catheter, okay? It's not very big, is it? This doesn't take much to put into somebody. I'm going to set my goop in there. And I'm going to throw that from the top. Remember, not to throw from the waist, throw from the top. All right, and I'm going to lubricate my tube. Now, this doesn't have anything else with it because we're not inserting it and leaving it there. So there is no catheter balloon that you will need. It's very simple. All right, so I've got that lubrication sitting here. I got my tongs and I've got my chlorhexidine on 3 of my wipes. Now, just like with the male genitalia, females use 3 wipes as well. They're a little bit different. They don't just go from inside to outside in a circular motion. They will go in a different order, which is now requiring me to basically start my process here. So I am going to take my non-dominant hand, and that's going to become not sterile, right? It has to hold back the labia and look for the part that I need to insert into, which would be your urethra, okay? I see the urethra right here. It's on the top. As I pull back, I see it. So my hand is going to stay here. Is that hard to do? Sometimes it is hard to do. I'm going to grab those 3 wipes, and I start, just like I open my kit up, away from me first. I go from the top down, and I chuck it. I grab a second one. I go from the top, closest to me, down, and I chuck it. Now the part that we're going to be inserting that catheter into is last. So the middle, top to bottom, down is the last wipe I can do. Now I'm throwing all that away. If you want to look back over here, I'm going to grab the center of this, okay? This is sterile. I can hold it with my hands. I'm pinching it over here and I'm trying to grab my tube, which has already been lubed, and I'm going to say, hey, Josie, we're going to start this process now. Are you ready to go? Yes, she says she's ready. Take a deep breath. And she's breathing in, and I'm pulling this in here. Now, what am I doing? I'm pushing it in as far as I can until I see return. Okay, I see return. Return is coming. Let's say it's filling up with yellow, clear urine. It doesn't smell to me. I'm checking it. I'm looking at it. If I were to need to get a sample, I could then put my sample in here for now. And let's say I filled that sample. I'm going to set it over here on my table. And then I'm going to keep going. If I'm asking Josie maybe to feel around her stomach, maybe she's kind of moving a little bit. Maybe I need to move her head up, so she moves her head up a little bit, see if she can get any more urine out of that bladder. If I don't see anything else coming, I'm going to start the process of removing. I never reinsert. Okay, don't ever reinsert or go further in. You only go out from this point on. So I'm pulling out, and let's say, oh, I see urine again. So then we're going to stop, and we're going to let that urine flow. As long as it's flowing, I'm going to leave it there. It stopped again. I go back out a little bit more. Oh, I see some more urine again, so I'm going to wait. I'm waiting, and I don't see any more urine. So now I'm going to retract it again back out. And I keep going. I don't see any more urine. I don't see any more urine. And then I'm setting that catheter here. Now, this catheter could potentially just be sat in here. I'm done with this process, so I'm going to take this and my hands, and I'm going to set this back over here. Now, let's say I'm going to remove this catheter because it's got urine in it, and I need to double check this line, okay? So I'm still sterile. I was sterile. I'm not sterile anymore, but I can take a look at my container, okay? There are going to be notches on your container, and you can measure out how much urine is in there based on the numbers on the side, okay? Now I need to be concerned about my patient, right? So I'm going to take my gloves off, wrap the other one in the other glove, get these off. I'm going to hand hygiene, grab a pair of gloves, and I'm just going to help this person, this patient, get comfortable again and clean them off. Sometimes we'll use this section here, or you can use a fresh washcloth and kind of remove it, get this person's legs back down, because that's our top priority. Are you doing okay, Josie? Yes, she said she's doing okay. I'm going to get the blankets back on. And then my last priority is to clean up, okay? She's my main priority. I say, Josie, is there anything else I can get you while I clean up? Nope, there isn't. Okay, so I'm going to then grab all my things. Maybe I want to put this top on this specimen cup. Maybe I want to think about cleaning this off with a little alcohol wipe. And then maybe we think about putting this sticker on and putting all the information on it and sending it to the lab. So that's something we can do. And then cleaning up the rest of your spot, making sure everything looks good, taking off your last set of clean gloves, and getting hand hygiene on again. And that concludes your insertion of a straight catheter.